My name is Regillo, and I'm the Director of the Retina Service at Wills Eye Hospital and Professor of Ophthalmology at Thomas Jefferson University School of Medicine in Philadelphia. I got involved in the CentraSight treatment program last year. Significant vision loss from AMD is a major public health problem. Approximately 2 million Americans have advanced forms of AMD. Over 500,000 of these individuals have end-stage AMD. As a retina specialist, we are searching for something, a way to help these patients, which we really have no good answers for. So after having a very good experience with the telescope implant in clinical studies and being aware of favorable clinical trial results, I knew the device would be of great value for many patients with end-stage AMD and look forward to being involved with the CentraSight program after FDA approval. FDA approved, the telescope implant is the first medical device to be implanted inside the eye for patients missing their central vision due to end-stage AMD. The telescope implant reduces the impact of the central vision blind spot. In general, patients in the FDA clinical trial were able to see 3 to 4 lines better on the eye test and demonstrated improved quality of vision. And this includes ability to complete daily tasks such as reading activities, the newspaper, recipes, whatever, leisure activities, watching TV, sporting events, everyday essentials, paying the bills, writing checks, and also regain independence and re-engage in social activities, recognizing people's faces, returning to favorite hobbies, playing cards, for example, being more confident going to and from unfamiliar or even familiar places. The telescope implant functions like a telephoto lens of a camera. It magnifies the images so patients can see them better. The images are projected onto the healthy part of the retina, not affected by the AMD. So the telescope implant also allows patients to use natural eye movements to scan the environment and reading materials. In the pivotal trial, 90% of patients achieved greater than 2 lines at 12 months, and 60% gained greater than 3 best-corrected visual acuity lines at 12 and 24 months. Long-term follow-up data demonstrated mean best-corrected distant visual acuity improvements were generally retained at 36 and 48 months in the telescope-implanted eyes. Additionally, patients also reported improved quality of life, as assessed by the NEI VFQ-25. Now compare this to the age-related eye disease study, where advanced AMD patients had cataract surgery only gained 1.9 letters. The telescope implant is a better treatment option for many of these patients. Ocular complications encountered during the studies included endothelial cell loss, maybe some inflammation or pigment deposits, transient corneal edema, and intraocular pressure elevation. CentraSight is the treatment program using the telescope prosthesis that is implanted inside the eye to improve vision and quality of life for patients with the most advanced form of macular degeneration. The program involves the patient evaluation and care by a team of eye physicians, including a cataract surgeon, a retina specialist like myself, and a low vision specialist who work together to assess the patients for treatment and provide the follow-up care. When I'm presented with a patient with advanced AMD, I determine the status of the disease in terms of whether it's active or not and how the patient's functioning. If the macular disease is stable and the patient is having trouble functioning with standard spectacles or even external low vision magnifying devices, I start to explore with the patient the prospect of having the telescopic implant. The telescope implant is intended for patients with the most advanced form of macular degeneration. However, not all end-stage AMD patients are a good candidate for the implant. In addition to vision and corneal health requirements, patients must be phakic and stable, meaning no active CNV, in the eye in which the telescope will be implanted. It's also important to identify patients who understand the capabilities of the implant, and this is important, have realistic expectations about what they might be able to achieve with it. They should be motivated and willing to put in the work that's required postoperatively to successfully adapt to their new vision status. I've seen the impact this tiny device can have on a patient, their caregiver, their families, and now, thanks to the recent FDA approval that reduced the age criteria to 65 years, even more patients can have the opportunity to benefit from the device. I've had several patients get the device and really appreciate not having to rely on others for essential tasks. even rather mundane ones such as writing out checks to pay bills. For many, managing their finances is not only an important thing, it's a personal thing. And having to delegate that function has both negative practical and emotional aspects to it. Seeing the faces of friends and relatives better is really big. It brings tremendous joy and reconnects them socially. It raises spirits at a time in one's life that health problems can often be overwhelming.